Hi, this is our presentation for Psychology 331, Section 002. Our presentation is on the aspects of personality that contribute to PTSD. The people that worked on this project are Christina Harwood, Chloe Beatty, Faith Brandt, and Chloe Miller. So the introduction and definition of PTSD. So PTSD is a disorder in which a person has difficulty recovering after experiencing or witnessing a terrifying event. The condition may last months or years with triggers that can bring back memories of the trauma accompanied by intense emotional and physical reactions. So in this presentation, our main goal is to help explain and demonstrate how 1. PTSD symptoms and signs can be measured, predicted. 2. PTSD can correspond with perhaps a specific type of personality within an individual. 3, the phenomena behind PTSD, and 4, how various types and methods of resilience can be useful in preventing PTSD symptoms from worsening.
Measure and resilience factors. Example measures of PTSD or low resilience are as listed. Demographic characteristics such as age, gender, race and ethnicity, and your level of education. Trauma exposure, negative childhood experiences, symptoms of psychological distress and emotions, neuroticism, harm avoidance, hostile or anger, and resilience factors can help reduce the risk of developing PTSD, such as seeking support from other people, learning to accept one's own actions in the face of danger, having a positive coping strategy, being able to act and respond effectively despite feeling fear. Trait resilience versus PTSD. Temperament and character traits have been related to PTSD, but in cases, state resilience is considered as the absence of the disorder. Higher rate resilience related to higher average mindfulness and lower negative effects describes successful adaptation. Despite there being evidence that temperament and character have a relationship with trait resilience, studies have not assessed the presence of exposure to trauma and psychopathology. Neurobiological markers of trauma exposure, post-traumatic stress disorder diagnosis, and resilience to trauma to identify a diagnosis for PTSD.
Resilience activation framework. So research has found that resilience to traumatic stress decreases the chances of developing PTSD. So Wright and Maston developed the 4 waves of resilience research. These waves of research took different processes that predict resilience. So according to the waves of research conducted by Wright and Maston, personality traits that predict resilience include hardiness, self-efficiency, and self-esteem. So the study, the question of the study was, are personality traits the only thing that can predict resilience after traumatic events, or are there other factors? So the study looked at natural disasters in coastal regions and their impact on the residents that live there. And it's looked at that lower resilience to natural disasters ultimately resulted in a lack of resources and support. So it wasn't just the traits that predicted lower resilience or higher resilience, it was also the resources and support in the area. And the conclusion was that personality traits are not the only thing that predicts resilience, and this was according to Abramson. Okay, MPY resilience to PTSD. So once again, research has found that resilience to traumatic stress decreases the chances of developing PTSD. A study conducted by Kotz, Charney, and Maru looked at the neuropeptide Y, which is also known as MPY, and how it aids in memory and the regulation of homeostasis. And they took animals and they exposed these animals to high stress or traumatic events, and they read the results of their MPY levels, and they noticed that the MPY levels were lower in those that experienced traumatic events. But animals that were exposed to similar events that had coping skills resulted in a higher MPY level. So the question is if you can inject MPY into the amygdala, and will that increase the resilience in animals? So how could NPY be the solution to PTSD? You could possibly give people NPY via maybe an injection, they don't really know yet, and it would increase the resilience to high stress events. As a result, their PTSD symptoms would decrease. So research is happening to determine the best route for this administration of MPY, but it's not conclusive yet. And on this slide, as you can see, it just kind of goes over the process of it. So over here, okay, you can cut out the end. Okay, so this image looks at both the childhood stressors, which could be traumatic events in your childhood, and then also the genetic components, NPY levels, and how that results to traumatic stress and what the optimal NPY conditions are for you to develop resilience. And if you have resilience, the greater your resilience, then the less likely you'll develop PTSD, or you'll be able to overcome PTSD to an extent. You'll be able to manage the symptoms.
The power of the social support system. According to the American Psychological Association, resilience is defined as the process of adapting well in the face of adversity, trauma, tragedy, threats, or even significant sources of stress. A general consensus is that resilience is a complex phenomenon that, for each individual, may have specific meaning that varies by phase and domain of life, and may, but does not always, lead to the abundance of psychopathology. Social support is a complex construct with many definitions. Cohen's definition explains that social support refers to a social network's provision of psychological and material resources intended to benefit an individual's capacity to cope with stress. For example, in a study of patients with cardiac illness, high social support was linked to increased use of active coping mechanisms, such as problem solving, which in turn decreased the likelihood of developing depression. And in addition, high social support might increase feelings of belonging and solidarity, encouraging healthy coping behaviors, etc., such as exercise, help an individual to redefine a difficult situation as being less threatening, and enhance regulation of emotions such as mistrust, anxiety, and fear. In a continuation of the power of the social support system, the effectiveness of social support depends on the match between the source, type, and timing of social support and the needs and developmental level of the individual or system. As such, support provided in a sequence of inconsistency with the present needs will either be effective nor recognized as helpful. For example, cognitive support may be perceived as most helpful when the individual is ready and asks for it, but not when it is unsolicited. The development of stress and threat management circuits is influenced by multiple experiences, starting in the first years of one's life. Experiences that activate these circuits are considered stressors and, under normal conditions, promote learning of adaptive responses to subsequent stressors. However, exceptionally stressful experiences early in life may have long-term consequences for children's cognitive, social, emotional, and physical health. Therefore, it has been proposed that social support can actually moderate genetic and environmental vulnerabilities to confer resilience to stress, possibly by its effects on these systems. Openness and its correlation to post-traumatic growth. So I'm going to start by defining what openness is. So openness is a person's receptivity to new ideas or experiences. So that's how willing they are to experience new things. So in the study, personality factors and their impact on PTSD and post-traumatic growth is mediated by coping styles among OIF and OEF veterans. So in this study, they started out by measuring, and the things that they measured were the total trauma load. They used the test Deployment Risk and Resilience Inventory, the DRRI. They then went on to measure the post-traumatic stress disorder. They used the PTSD checklist, the civilian version. That would go to diagnose them for PTSD, as well as to figure out what symptoms they struggled with and how prevalent it was for them. They then went on to measure the post-traumatic growth with the PTGI. They then measured their coping and behaviors, so they used the brief COPE survey. They then went on to take personality tests, and they used the Big Five inventory. They then went on to measure the optimism and used the life orientation test. Openness and its correlation to PTG continued. So the results that came from this study, they found that it was prevalent that those that had openness as a major personality trait, that correlated with their ability to have post-traumatic growth. Those who scored high on openness on their personality test generally also scored high on having adaptive coping mechanisms. So openness and adaptive coping mechanisms tend to go hand in hand. Those who are more willing and open would be prone to trying different methods and techniques, to cope with their condition. Those who scored lower on openness had a high correlation to maladaptive coping mechanisms. These people were more stuck in their ways and unwilling to try different techniques to cope with their condition. These veterans also showed less post-traumatic growth after the fact. So, in conclusion, the study showed that people with healthy and adaptive coping mechanisms are more likely to have a decrease in symptoms for PTSD and an increase in post-traumatic growth, and were also tended to be more open on their personality test.
The cognitive processing therapy for PTSD. So, what is cognitive processing therapy? Cognitive processing therapy is a manualized therapy used by clinicians to help people recover from post-traumatic stress disorder and related conditions. It includes elements of cognitive behavioral therapy treatments, one of the most widely used evidence-based therapies. CPS could be a more direct route to change than having clients imagine the traumatic events repeatedly, as shown in Figure 113, where we have the PFC, the amygdala, and the brainstem extending neurotransmitters, and this light bulb represents the traumatic focused cognitive therapy towards the amygdala. And in neurobiology, it also helps us to understand why people, especially younger children, are more likely to develop PTSD, as the prefrontal cortex is not yet fully developed until well into adulthood, so they are more prone to traumatization.
The conclusion synthesis. So throughout the journals, there is a reoccurring theme that a high level of openness, this is according to the personality factors and their impact on PTSD and post-traumatic growth and mediated by coping style among OEF veterans study that talks about the openness. And the resilience are factors that provide to aid in reducing the effects of PTSD and increase the effects in post-traumatic growth. High adaptability to cope and have strong support systems are often the main contributing factors to decreasing symptoms of PTSD and increasing post-traumatic growth. This is according to the How Does Social Support Enhance Resilience in the Trauma-Exposed Individual. So in other words, somebody who has developed PTSD and learns to redefine their experiences via resilience are more likely to decrease their chances of developing PTSD or reducing the symptoms of PTSD. This is according to the perspectives on resilience, trait, resilience, daily life, long-term change. Notice there is no proven cure for PTSD, there's only ways to manage the symptoms, and this is according to the neuropeptide Y resilience and PTSD therapeutics.
For conclusion analysis, in conclusion, PTSD is a condition that impacts many people from different backgrounds. However, through many studies, it has been observed that resilience, openness, and adaptability to cope are core traits that improve post-traumatic growth and decrease effects and symptoms of PTSD. These are all aspects of the psychological triad. Resilience and openness are categorized under the thoughts section, whereas behaviors of being able to adapt to different coping mechanisms are a large contributing factor. Feelings of being able to utilize a social support group are all contributing factors that allow people to recover. These studies showed the variety of factors that predict resilience. Typically, an increase in resilience results in a decreased chance of developing PTSD or decreases the severity of symptoms.